Okay, good afternoon. Can you hear me? Right. Okay, great. Oh, there's a baby around. Okay, you have a very comprehensive program today, both medical and non-medical, antenatal and postpartum. So I do look after a lot of the pregnant women, but what I observe is that we have very little time and very little understanding or even information regarding looking after the mother after the delivery. Right? I'm not sure whether you have discussed anything with your doctors about this. Even for me, usually I discuss all the topics with my patient. I find it very difficult in terms of time to give them enough to talk about postpartum care. All right? So a lot of our postpartum care is so-called subcontract to the grannies and the confinement women and your friends and their friends. So you are actually being looked after by a lot of things, a lot of people who have very narrow view about postpartum care, but because there's so many of views in all, you get a lot of messages coming from them. Okay? This is unfortunate, but along the way you'll know why. Okay, my name is James and I work with Sincere and I work with Astra. So the topic is post-delivery vaginal reconditioning. This is a new term. I don't think anyone have heard of it because it's a new trend that's going to come on. Okay? Postpartum care involves many aspects, as you know later, but the vaginal reconditioning is something that is very unique and is very positive in terms of what you can do in the months ahead for those who are going to deliver. The take-home messages I have for you will be 3 points. The first point is post-delivery care is critical phase of a pregnancy. Don't ignore it. Okay? All of us are so engrossed in looking after the baby when it's in, looking after the delivery part of it, and we ignore the post-delivery care. Second point is that vaginal reconditioning is something new. It will help you along, as I discuss later. And I'm going to talk about vaginal laser therapy as a form of reconditioning. I start off with these studies back in 1995, which was one of the very few studies to talk about postpartum morbidity. Morbidity is the term that we coin for ill health. Okay? So what it tries to say is that it's a very widespread and it affects majority of the women, except that sometimes they don't even know that it affects them. 71% reported one health problem at 8 weeks after delivery. So most of the people will complain about something, okay, that needs to be done or needs to be looked into, except that many a times they have nobody to seek help from. In this table, it illustrated some of the common problems that is encountered by the woman. I just highlight the pink square, all right, regarding perineal pain, sexual problems in dyspareunia, stress incontinence that a woman will encounter, backache, a lot of you already have it even before your delivery. Hemorrhoids, again, a lot of you have it right now towards the 3rd trimester and continue to have it into the first few months of your delivery. And lastly, fecal incontinence and bowel problems. Okay? These are all related. They are important because right at the beginning of the 0 to 3 months is quite significant. Okay? Almost 1/3 of women will have some of this. But towards the end, you notice that after 6 months, some of the problem persists, whereas others somehow resolve spontaneously. Okay? The one that really continues will be, look at this, at 6 months, sexual problems and dyspareunia. Dyspareunia is a term that we use for painful intercourse. All right? It continues to trouble a lot of women. Almost half of them complains about it. Do you all complain about it? Most of you don't. But if you were to ask yourself, do you have a problem? Most of you do. Okay? Right. Problems arise after hospital discharge. So most of you will be in the hospital for 2 or 3 days. You're very excited, very happy. Okay? But once you go home, the problem starts. And it varies from the mode of delivery. We know that those who have a Caesar will probably have a better time in terms of postpartum care, although there'll be a lot of pain, right? But for those who have vaginal birth, they have the, actually for those who have vaginal birth will tend to have a certain amount of morbidity, but it will be made worse if it's assisted by either a forceps or the vacuum. Okay? As I said earlier on, most of the conditions improve with time, right? But some of them do persist into chronic conditions, and that's where we come in. Yeah? Now, do they need help or do you all need help? Most of the time, you're so busy with your child, you're so concerned about the family needs, okay, that you ignore all your small little problems. That's why, okay? Your own health concerns seems to be the last to be addressed. You're worried about the baby's feet, you're worried about the baby's, jaundice, you're worried about the baby, whether he's eating and shitting and all kinds of things. But with regard to your own health, you ignore it, okay? Sometimes to your own peril. Sometimes it's too embarrassed to share. Why? Because the issues that we are talking about is very personal. It's involving the pelvic floor, involving the sexual organ. So a lot of you do not share it with even your partner because of embarrassment. Okay? So therefore, you endure it for many months. And then eventually some of them actually get better. Okay? So you actually suffer for about 6 to 9 months of ill health. Okay? Quietly, silently, suffering through and hoping for a change, which eventually it came, but you realize that even though it improved, you were never the same after delivery. Okay? Now, so the initial weeks, either self-helped, okay, or you go by your traditional measures. So your confinement woman will explain to you what to do, what not to do. This is based on her experience, her limited exposure to the few or the tens or hundreds of women that she cared for, but it's still a limited experience. Okay? The other problem that we have is that most of the doctors are also not interested in your problem. Okay? Most of the gynaes will never talk very much about postpartum care because it's not where the, all right, we don't use the word, it doesn't reap in the rewards. Okay? So most of them will just quietly just tell you that you will pass off, you will be fine. So we are not very interested to look after your well-being in that sense. Okay? Sometimes we don't have help because we have not looked into it, we have not done much research into it. So if you tell me that my confinement woman wants to feed you with all this kind of food, confinement food, do I have an opinion? Unfortunately, I don't have much of an opinion. The reason is that I can't say yes or no to it because there's no evidence one way or another. Okay? So as a result, we leave it to your own traditional ways, and that's not very appropriate. I mean, there's no science behind postpartum care in our local context, unfortunately. Okay? So as it goes on, in the later weeks, in the later weeks, since your health improved, okay, you gradually will accept the state of suboptimal health that you have maybe 9 months into your pregnancy, after your pregnancy. You improve, but you don't improve completely. But you adjust to it, and therefore you live with it. Okay? So that's what is happening to most of the women. So the disturbing thing is not that it's a very prevalent morbidity. Okay? We know that it's there. We know that most of you suffer to some extent. Okay? It's the profound silence that surrounds this condition, okay, that eventually give us this whole problem, that we cannot develop it further. Everybody is quiet about it. Nobody talks about it. Nobody wants to lecture about it. Nobody wants to complain about it. Okay? And that's the sad thing. And we should discourage it. So these are the common things that can happen in a postpartum woman after delivery. You have very serious complications. This one you will end up in a hospital. All right? Severe bleeding. You got blood pressure problem. You got infection of the wound. Okay? Or sometimes you got deep vein thrombosis where the blood clot. And this is peculiar to pregnancy. And these major complications will bring you to hospital, and we look after you for that. Okay? We are good. But when you come to this aspect, the common problems, okay, most of you will just have to handle it by yourself. You can be tired, you can be tearful, you can have headaches, you can have depression. Reactive depression is so common. I got a woman who delivered and completely lost her mind because she doesn't know how to look after the baby. She can't breastfeed the baby, and when she came back in the first week, she was in tears, full stop. Okay? And the husband got to really support her. And for her, we had to stop her breastfeeding because she just felt so useless. She can't handle the breastfeeding. Okay, breastfeeding is a big issue, all right, which I suppose somebody had spoken about it earlier on. Backache, as I said, is something that's physical. There'll be a lot of postural aches that come from the woman after delivery. You can have sacral ache, you can have central backache, you got, what else is there? You can have neck ache because of the pushing, the position that you have used during the delivery. All these are common. Okay? The perineum, which is the bottom half where the cut was made, is usually painful, and it's painful for 1-2 weeks, sometimes more, if the stitch split. Okay? So therefore, be very careful when you look after your perineum after the delivery. Okay, you also have things like constipation, the hemorrhoids that I talk about, and sometimes you can't control your motion, okay, for the severe ones. Now, this part here, the sexual difficulties, nobody talk about it, we'll talk about it later. You have difficulty in peeing because you had epidural and you over-distended the bladder, and someone went home without actually peeing well and continued not to pee well and damaged the bladder as a result, okay? Sometimes it happens. You have incontinence. Incontinence means that you can't control the urine, you leak, okay? And obviously, towards later part, you got a very lax vagina, and some of you do prolapse. All right, so these are related to the delivery. I group it into this few, okay, just to reiterate. You got the emotional, psychological issue, the breastfeeding issue, and the musculoskeletal joint issue. But this is not what I want to talk about today. I want to focus on the bottom three. What I call the vulvar atrophy, or vulvar vaginal atrophy, sexual dysfunction, pelvic floor, and vaginal support problem. Okay, that's where the focus is. Now, should we be concerned about the health? The answer is yes. I told you earlier on, pregnancy changes the vagina physically. It will never be the same. Even if you deliver by Caesar, it will never be the same. Okay, that's the truth because for 9 months, your vagina and the pelvis has to, have to support a growing, progressively growing uterus with the baby inside. Okay, every day is subtending the pressure on it. So therefore, it changes the structure of the vagina. Okay, how is the extent of change depends on the way it delivers, depends on how long the delivery, the whole labor is, depends on how big the baby is. Okay, all this has a factor to it. Now, after childbirth, the vaginal pain and discomfort may be severe in the short term. You all can tolerate it, okay? But this kind of discomfort pales in comparison to the emotional trauma, the loss of self-confidence, and the denial of sexual enjoyment for many years if you don't look into some of the issues, okay? Simple question is that for those who have delivered, okay, ask yourself whether your sexual life has changed after delivery compared to before you're even pregnant. Okay, most of you will say yes, it has changed for many reasons, all right? But one of the reasons is that, well, you don't feel the same anymore, okay? That is very common, yeah? Ill health in the vagina can be expressed in the form of excessive discharge, can be coming from itch or soreness, can be due to varicosities. These are just pressure effect from the venous congestion in the vagina. Okay, there can be recurrent infection, recurrent vaginal infection, recurrent urinary infection. It can be expressed in painful intercourse, or similarly pelvic pain. These are the acute phase where the problem is there. It affects the vagina. It gives rise to all these little inconveniences. But over the many more years to come, okay, it affects the sexual dysfunction, it affects the incontinence, as well as the prolapse issue. Now, sexual dysfunction. Loss of sexual intimacy, okay, has an adverse impact. Okay, not just immediately after delivery, but for many years to come. It affects the quality of your life, the female, the ladies, okay? It also affects the overall marital relationship. Yeah? Okay, so we have heard about many difficult couples going through difficulties, and if you were to ask them, they'll present to us with a lot of marital issues that seem to be on the social level, that seem to be on the day-to-day difficulties at work, or even relating to the in-laws and things like that. So there's a lot of things, but when you zero in down deeper, okay, you find that actually the problem started when they stopped being together. Okay, when they stopped being intimate. Physical intimacy is an expression of the relationship between the two, how close they are emotionally. You cannot be physically intimate unless you're emotionally close. Okay, I mean all of us know that. So when something happened, if you look into the origin, somehow along the way there is a problem with the sexual contact. Okay? It may be leading to it or it may be as a result of it. So you cannot ignore that part. All right? So up to 80%, okay, of women reported sexual dysfunction after childbirth. But therefore, only a small percentage of them present to whether the psychologist or the counselor or the therapist for help. Why? Because it's something very private and nobody likes to talk about it. Okay? Now, this is a study back in, I think, 2014, around there, in Australia. And they talk about the prevalence of risk factors and risk factors of sexual dysfunctions in Australian women after delivering their babies. Okay? In summary, 64% experienced sexual dysfunction during the first year of childbirth, and 70% roughly reported dissatisfaction. That means they still can function, but they are just not happy. Okay? So it's a 2/3 kind of ratio within a year of delivery. Types of dysfunction, most of it, desire disorder. They just don't feel the need to want to be together, to want to be intimate. Okay? Arousal problem, about half of them, they get engaged in activity but they cannot feel the good feeling. They can't be aroused, they find it difficult to get aroused. So after some time, that's where it peters off, the activities. And then orgasmic problem also in about half. So there is a real issue among the Australian people. Okay? So can we translate it back into our local community? Maybe not directly, okay, but it does show that it is a problem in developed nations. Okay? If you talk about it, it will be there. The cause for sexual dysfunction post-delivery can be psychological, because as a mother, you have a different priority now. Okay, your concern is mainly on the baby. You put the husband aside. The husband will be... Okay, there's a funny thing. This morning I saw my patient. This is a second child. They come in with a second pregnancy. The first one is about 3 years old. And I asked them, so how are they? They managed to get pregnant, obviously. But they are trying to wean off the first child. And I said, at 2.5 years old, he's still feeding the baby, the first one. Then I said, how is it possible? Then the mother said, it's only for the night feed. Then fine, then where's the baby at night? He said, yeah, with them. Okay? So the baby, two of them, the eldest and the second one, actually sleeps with the parents. Okay? All this while, since the first one was born, which was 5 years ago. Sorry, this is the third pregnancy. So first one is 5 years, second one is 2 years. All right? And they have been sleeping together as a family in the same bed. Okay? So that the youngest one can still feed on the mother at night. And they managed to get pregnant the third time, surprisingly. But obviously the privacy is not there. And obviously it is very difficult for them to really resume their own sexual life, right? This is very common. It's not the first time I heard of it. Okay, a lot of this thing happens. Okay? So, well, that's our culture to some extent. Okay? And is it something good? You got to think about it. Now, change of self-image is always there. After your delivery, after a normal delivery, many women will feel very different, okay, from the sexual organs point of view. Okay, they feel different because they are different. They feel different because during intercourse they also do not have the same kind of feeling as before. Okay, so most of them will experience some laxity problem. Okay, unless they are very positive about it, sometimes they withdraw, okay, from being too intimate because they don't understand how the partner actually take upon the change. All right? So therefore, unless you're very open about it, you communicate with a partner, and sometimes the woman actually will pull back from sexual activity as a result of the change in the body. Physically, they can be tired after looking children, one or two of them. Then they may also be having pain. Okay? Pain due to the delivery process in the perineum, as I said, due to the cut, due to the prolonged labor. Sometimes they have residual pain. Even when the cut is healed up, a lot of them has what we call nerve pain from the nerve that has been severed as a result of the stitching up. Okay? Even though it's beautifully healed up, they still feel soreness or sometimes very focused pain at the perineum. Okay? So this one you have to seek help in order to resolve it. Okay, as I mentioned, vaginal laxity is always a problem after normal vaginal delivery. Then the last part is about hormones. Okay, when you have a lot of female hormones around you, sometimes your libido collapse, okay? And then after delivery, you haven't recovered that, so the libido, the sex drive is always low. So that's why earlier on you say the desire is not there. Sexual desire is always a problem in the first year or so, okay? Especially if you are breastfeeding. Then we talk about vaginal atrophy, okay? This will be important. I will illustrate in the next slide. So our local experience is that majority that I talk to do not resume sexual activity after 6 months, okay? So when I see them 1 year later, they say, oh, they're starting again. First 3 months, most of them, never. Okay, they were so preoccupied with child care of the baby that they ignore it completely. All right? The frequency of sexual activity also dropped drastically. And because the reduced activity continues for many years after childbirth, it's not just in the first 3 months. Okay, you ask your friends, many of you will get the answer. All right? So the reasons is usually not just to the pregnancy or breastfeeding. It's also, as I mentioned, on the way that we condition ourselves, the way that we look after our child care, the arrangement with the babies. All these are factors that make Singapore society very low, okay, in terms of our sexual activity level. Okay, so we're also famous for that. Also in terms of the work commitments and expectations. All right? So what shall we do? We can leave it alone, okay, which means that like our grandparents, or probably they are better off, our parents usually, that generation is the one that is affected most because they are driven by economic progress, okay, and they're working so hard and they ignore about their own quality of life. Okay, for you all, it depends on your attitude towards what you want in life. Okay, you may have to change it, or you just follow the traditions as what has always been. Now, vulvar vaginal atrophy. Most of you do not understand that you actually have it after delivery. The women usually complain about itchiness and soreness. They complain that the vagina is dry. They sometimes feel that passing urine is uncomfortable. And obviously when having sex is painful. Why is it so? The main thing is the hormones, okay? If you were to look, for us, we check the woman folk after about 2 weeks, after about 6 weeks, and we always notice majority of you have very dry vagina, okay? And you find that even doing a speculum examination at 6 weeks for your pap smear is very uncomfortable, okay? The reason is that the vagina for the last months of the pregnancy and towards the first few months of the post-delivery phase, you do not have the estrogen going around in your body for that menstrual cycle kind of influence. So therefore, without the estrogen, your vaginal skin thins out. It is the same as your grandmother who is in the menopause state. Okay, it's the same phenomenon. Lacking of estrogen will give rise to thinning of the skin, and because the skin thins out, the glands are not working, so therefore during sexual activity the arousal doesn't come around so easy. You don't have the lubrication. Okay, so that's why. But most of you are not aware of it because first 3 months most of you are not active. Right? You're not sexually active, so you ignore it. But actually some of you do complain that when you walk around or when you do certain things, you feel uncomfortable. Okay? So, can you leave it alone? Hang on. When I look at the examine, okay, as I mentioned, we will see that the vaginal lips are shrunken, okay, and it's very dry and it lost the sheen that the normal blood, we call it the vascularized labia will be. Okay, so it lose the kind of turgor. So this is what happened graphically. This is a normal skin here. You can know that it's quite thick. This is we call the dermal layer with full of collagen. Okay. When there's an atrophic situation, the whole upper layer is thinned down, largely because there's no blood supplying the cells, so the cells doesn't grow, so they die off. And this part here is very pale because the collagen layer has actually collapsed as well. Okay, so that's atrophy. All right, okay. It happens in the menopausal woman. It happens in the postpartum woman, especially those who are breastfeeding. And it happens to those who receive chemo treatment. All right, it's the same phenomenon. Right. So if you were to leave the vaginal atrophy alone, after maybe about 2 years, 1 to 2 years, it will probably improve, okay? Because That's the time when your cycle comes back, especially for those who stop breastfeeding. But then you have to understand also that after that you probably have a second child or the third child, and then they will go through another phase of hormonal change. So that in a woman's life, potentially if you have 2 or 3 children, you have about 6 years, okay, where your vagina will not have the regular estrogenic input. Okay, so will that affect you in the future? Answer is yes. Okay, the health of the vaginal skin, okay, if it's atrophic for so many years, all right, will have impact when you're in your 50s in terms of the symptoms of incontinence, the symptoms of prolapse. All right? So we should look into that. Now, coming to the pelvic floor and vaginal support, okay? Delivery-related pelvic floor trauma is a reality, and it's not a myth. Why is Peter Dietz saying that? He is saying this because he has spent 20 years of his life doing scan, okay, developing scan, ultrasound, 3D scan, MRI, just focusing on the pelvic floor before, during, and after delivery, and he confirmed, okay, that even a normal, all right, vaginal delivery, after that, 30% of the women will have disrupted levator ani, which is the pelvic floor muscle. Okay, that can be picked up clinically, and on scan, okay, with regard to the anal sphincter, again about 1/3. So just anybody who goes through the vaginal delivery, 1/3 of you will have your muscle torn, even if it's a not very traumatic delivery. Okay, that's what he found. Okay, on this picture here, which you probably don't understand, the difference is that this is an intact ligament, where we call it the avulsion and levator ani. This intact stretch onto the bone on the side, whereas after delivery, the whole thing here separated. Okay, this is seen in many women, and this is the anal sphincter that controls your bowel movement. The ring here is gone. It's supposed to be one complete ring of muscle. Okay, this bit here has been again disrupted and failed to reconnect. So therefore, they always have trouble with controlling. In this case, will be farting. You can't control your fart very well. Okay. Now, in this study, just a bit of figures to show you. This is in 2011 reported. The prevalence of UI, which is urinary incontinence, at 12 years. This study follows a patient who has delivered one baby for 12 years. And they found that the prevalence of incontinence, which about once a week, is about 23%. For those who have more than once a day, more severe. Every day the woman is leaking at 12 years after delivery is about 5.4%. Okay? Now, if we break it up among those who have been delivered vaginally, VD, and those who have been sectioned, CS, you'll find that it's still quite substantial. All right? 54% among those who delivered vaginally against 40%. So to some extent, it shows that caesarean section does prevent or avoided some degree of incontinence problem 12 years down the line. All right? But it's not very much. It's both, even the Caesar woman will still have incontinence. Now, for fecal incontinence, where in terms of stool control, which is less than urinary control, okay, but it's still there. After 12 years of delivery, about 12% of women complain about stool incontinence. Another study, this one is even longer. Okay, this is 20 years after delivery. All right, and it talks about prolapse cases where the womb and the bladder is prolapsing down. So what's the result? Overall prevalence of symptomatic prolapse. Pelvic organ prolapse is whether the womb is sliding down, the bladder is sliding down, okay, after delivery. About 12% of women complain about that. And those who delivered vaginally, more than those who delivered by Caesar. So there's some preventive prevention in terms of having a Caesar with regard to pelvic organ prolapses. Okay, so the slides here is to tell you that we have been doing studies and following up patients who have been delivered vaginally and by Caesar, and it is a fact, okay, that the impact of your delivery affects your health 12 years, 20 years down the line. Okay, that's what I'm trying to drive at. All right. So what the mechanism of injury? Why should the normal delivery affect all this incontinence and prolapse? Because of the stretching. Okay? As the head comes through the vaginal canal, it stretches. How so? You look at this. This is a diagram that shows the head coming through. The yellow bit is the thin layer of the pelvic floor that we are talking about that keeps the organ in place. And as the head stretches through and trying to come out, you notice that it tears. Okay, it tears, try to get through the whole the round part of the head, and towards the end, the whole muscle is stretched out so that the head comes through. And if you look at this diagram, this one assesses the tension. This is at rest. Okay, reference is 1. This is at the end of the delivery. When the head is about to come out, you notice that the tension has actually increased by almost 2 times, the stretch effect on the muscle. Okay, so that's why, how can we not expect your pelvic floor and your vagina to change with delivery? Right? Okay? So it's quite obvious if you look at it. Oh. Oops, sorry. Hey, what am I doing? Oh dear. Go back. Oh dear. Above that one. Yeah, the earlier one. Next one. Okay, yeah. Okay, so the stretching is one thing. Just like I mentioned about avulsion, when the delivery is too sudden, okay, the levator ani avulses itself, that means tear itself from the wall, the bony structure. So that becomes like you have a hammock on 2 sides of a tree and then one just collapses, you got the whole hammock collapsing. Right? Okay? So avulsion is one issue, and that's what is shown by Peter Dietz when he did all the scan. Okay? So it's not just stretching, it's the tearing of the muscle. Third, nerve damage. If you have a big baby that's sitting on your pelvis for, let's say, 1 month engaged, the head is in the pelvis, it will impact on the muscle because of the nerve compression. Okay? So therefore, it's good to have the head engaged in the 3rd trimester, but it's not too good if it's too big and for too long, because that effect will be, on you. Okay? So therefore, we have ischemia coming on when there's too much compression. We have nerve damage coming on when there's too long an engagement. So in the beginning, most of you will show some minor change if you were to assess it, but you won't complain about it. Okay? Because only a few of you will complain about complete loss of function. Okay, but if you look into it, the issues are there. The latency period between the normal delivery and the onset of a clinical problem sometimes can be about 30 years, 34 years. So it's something down the line. Right, so the effect on the vaginal function will be 1, in the early stage, vaginal laxity, atrophy of the vaginal skin, leading to sexual difficulties. Then later on you have the incontinence part, and then you got the anal incontinence, and lastly will be the pelvic organ prolapse. Okay, this is the sequence of events. So we talk about conditioning now. How to help. Vaginal reconditioning is something that nobody talks about because we can't do anything. Even right now, my generation of gynae, we were not taught about how to recondition the vagina because there's nothing we can do. When I examine you post-delivery, I look at the vagina, I look at the laxity, I say, okay, there is some laxity. You can do your Kegel as much as you can to try to strengthen the muscle, but that doesn't help with the skin. Okay? So we just tell you that do whatever you can, but we can't help you now. So it will be maybe 20 years later when things happen, when the severity is such that the prolapse occurs and gives you symptom, then we come back into the picture and say, okay, now we can do something for you in terms of surgery. So there's a big gap, about 10 to 20 years, where we can't offer you anything. Okay? That's until now. All right? So the program of reconditioning is to find out, on one hand, okay, how bad the condition is, and to offer you a program where we, firstly, retrain the pelvic floor through all the Kegel exercises, and with the latest in town, to use safe thermal energy, okay, to recondition and rejuvenate the vaginal skin. All right? So we do it this way. The main idea is to relieve the immediate symptoms. Those who have vaginal atrophy, discomfort will be relieved. To improve on the sexual function, okay, because you relieve the pain, you improve on the vascularity, therefore the arousal will be improved, the sensation will be improved, okay? And more importantly is to prevent the worsening of the vaginal complex so that hopefully in 10-15 years you will not suffer from incontinence and prolapse. Right, so that's the objective. It's only possible because of these two things. One is the vaginal laser, two is the vaginal radiofrequency. These are nothing new. Okay, laser machine has been used since the 1970s and 80s, largely on the face. Radiofrequency likewise from the 90s and the 2000s when they developed the technology. Okay, but only in the last 5 years that we, the gynae people, start to use it in the vagina. So that makes the difference. Okay? Now, in terms of the CO2 laser, back in 2011, Gaspar is the one who shows that you can actually have improvement of vaginal atrophy by using laser. Then our friend from Italy, Salvatore, did a good study and shows that it actually improved. Documented it that the dryness, the itchiness, the burning, even the painful urination and the painful intercourse all improved after 3 sessions of vaginal laser. This, I'm afraid, is in the context of a postmenopausal woman because that's where it was first developed. Okay? Then Zabanati, another Italian, reported that it makes a difference even on histology because when you do the skin tissue, they actually see that before and after laser, there's significant improvement in terms of the layering. I'll show you later. And lately, Perino is trying to use it even on those urgency symptoms of the bladder. Okay? That's how we do vaginal laser. We put the probe into the vagina, we turn on the machine, and then we basically shoot the laser circumferentially, as you can see here, around the wall of the vagina. So every little hole here is a puncture, micro drilling we call it, where the laser light hits into the vaginal skin. Okay? It's not painful. That's what the woman says. Everybody says it's not painful. Whenever I ask them, they say it's no pain. What they feel is that they feel some vaginal vibration when the machine is on. Okay, so this is what you see in real life after the treatment. You see these little pock marks. Okay, this is a laser micro drill. So this is a very relaxed vagina. Okay, a woman who has not delivered will not show this kind of folds of the vaginal skin. Okay, this happens after delivery, whether it's second or third, I'm not sure. Okay, but when the bulge is there, we laser it. The idea is threefold. One, if the drill is powerful enough in the superficial layer, it will serve to contract the superficial skin of the vagina, and that brings the skin closer. So that's the tightening part. But that's not what we actually want. Okay, we want the laser to go in deeper to the skin with the idea of disseminating a certain amount of heat to stimulate the cellular regrowth in the deeper layer of the skin. That's where the cells start to grow and start to produce more collagen, and that is the one that thickens up the dermal layer. And when that layer deepens up or increase in height, it brings in all the blood vessels and all the nutrients. Okay, so it's like putting a pipe system into a desert, pumping in the water, and then the plants will all start to grow, and the cells will start to regrow. Okay, that's how it works. So this is a picture of the real thing after the lasering, and this is a histo report. Okay, that initially before treatment, that's what you get: a very thin epithelial layer, very denuded, and a very spaced out dermal layer. After treatment, this is what it shows. Okay, and this one is a normal woman compared to these two is in a menopausal state. So what is the difference between a treated postmenopausal woman's skin and a normal adult woman? Not much. Okay, because they can rejuvenate the skin. Okay, so that's what laser can do. Salvatore also did analysis on the sexual function among the group of women that he followed up on. Imagine this is a postmenopausal woman. What he found is that there is significant improvement in the total score on the sexual function scale among the 60-year-old women. not just I'm talking about 30 like you, okay, it's in the 60-year-old woman. After the after the laser treatment, okay, the sexual function improved and many of them actually resume the sexual activity. All right, so there is definite clinical outcome. Right, so I just show you a small clip, okay, of how the laser is done, and then to give you a little bit more impression. Here's the thing there. Okay. What I use as a Mona Lisa touch is just one of the 3 that's available in Singapore. Okay, so that's what you do. You insert the probe. And then we withdraw the probe as we shine the laser light around the skin. Okay, so what you get is the irradiation of the vaginal skin, and so the laser comes through and gets spread lateral-wise. So this is a probe as it draws down, so the light actually shines around 360 degrees. Okay, as we withdraw the probe. And so when the light hits in, you burn the superficial layer, which is very thin, and then the heat gets disseminated. So this is a sparse collagen that is in a menopausal woman. After the heat irradiates the cells, okay, the fibroblasts will start to work again, and therefore they release all the collagen's particles, and then they form into collagen fibers. And together with the collagens, they also have this glycoprotein, which attracts all the fluid into the dermal layer, okay? And so that builds up the whole layer very nicely. All right, so this is what happens. And so the blood supplies feed back into the system, and as a result of the blood supply improvement, the skin becomes thicker because the nutrients is being fed into the system. Okay, let's start. All right, so that's how we do the laser, and that's how it works. Beautifully, it has been demonstrated by the histology findings, so we are quite happy and quite confident, okay, to use it among those who have real vaginal atrophy. So the 3 groups of women are the menopausal, the post-chemo, and also the postpartum. Okay? Yours will be temporary, you know that. Okay, but it will take a few years for your own body to rejuvenate it. Okay, so if we can improve upon it, to give it a kickstart, then you will resume your function earlier. That's the whole idea about it, okay? You don't have to do it, okay, but you will improve, and because you improve your vaginal skin and the subsequent muscle layer with your Kegel exercise, okay, the idea is to delay any worsening of the impact of a normal delivery, more so of those who had forceps, okay, who use forceps to deliver, because the impact of forceps on the vagina is much more than just a normal delivery. All right? So, to end, it's a critical phase because short term you will have issues such as psychological body aches, breastfeeding issues. These are short term, okay? But mid term, your sexual difficulty will continue if you don't look into it. All right? Sometimes you will also experience some incontinence for the first 3 to 4 months. But long term wise, okay, that's where we talk about the prolapse and the prolonged incontinence come in. For the reconditioning, we will pack the exercises together with the rejuvenation, because when you rejuvenate, you only do the part of the skin and the subcutaneous layer. Okay, you can't do anything about the exercise, the muscle. So you need to exercise the muscle at the same time. All right? And lastly, the vaginal laser therapy has just been introduced 2 years back. This is the 2nd year that we have it, and it has been proven to be very safe. First of all, it's a non-surgical technique. There's no cutting involved. It is safe because there's no pain. Really, there's no pain, yeah. And it's very minimal discomfort. And the side effect, when they ask me, I say I can't think of any side effect because it's a physical treatment. You just use light and heat, okay? The rest of the body is not affected at all. And lastly, it is effective. That we prove it. Okay, so with that, I will end my talk, and I thank you for your attention. Anybody has any questions at all regarding postpartum care, what I've spoken? I'm quite happy to answer them. Is it too much? Anybody? No? Okay, fine. So with that, just bear in mind, don't ignore your postpartum care, okay? If you think they have a problem, do seek help, all right? Check with your gynae, squeeze them to do something for you, okay? Because many of them take it, just like you will settle itself, all right? So do not, I think that's not the right attitude. Not that they want to, sometimes you also don't bring it up, so they can't help you also. All right, so bring it up to them, discuss with them, so that you can recover much better. Okay? Thank you.